I'm Dr. Jane Hughes, and I've become increasingly concerned about the lack of rational debate regarding health care, an issue that affects each and every one of us at some of life's most important and intimate moments. Last week in a press conference, the President characterized physicians as mercenaries. He used an example of treating a sore throat with a tonsillectomy because the reimbursement is higher. This is a patent misrepresentation of the vast majority of physicians who are hard-working professionals who hold the patient's well-being first and foremost in everything they do in caring for their patients. Prior to that, he suggested that we use painkillers for the painless condition of cardiac arrhythmia instead of the more expensive but effective treatment, a pacemaker. This is not only morally and ethically corrupt, it is against the law. The current bill in Congress creates 30 new bureaucracies. Only one of those bureaucracies, the Bureau for Quality Control, costs $100 million per year in administrative costs alone. In my book, that buys a lot of medical care. It should be evident by now that politicians do not have the knowledge or the proper motivation to solve what's wrong with our system and preserve the finest health care in the world. There are problems with the system, but I fervently believe that the private sector and American ingenuity hold the solutions if given the chance in a non-chaotic, stable healthcare environment. The daily threats from Congress to socialize the entire system in rushed legislation has virtually frozen the private sector into inactivity. I suggest that we demand that Congress impose a one-year moratorium on new health care legislation and have them prove to the American people that they can fix the federalized health care they already have control over, Medicare and Medicaid. The President will still be there, and meanwhile, in the private sector, we can hold an American Health Care Summit. At this summit, we could gather all of the individual components of the healthcare industry and craft real-world solutions by the people who work in the real world of medicine. Myself and others have started an organization called United with Solutions for American Healthcare. You can visit us at usahealthalert.org. I have posted there a 12-point plan, and I'm going to post a video with the details of the plan. But it is a starting point for private sector solutions to solve what's wrong with the system without adding trillions of dollars to our exploding federal deficit and without intruding into private citizens' most intimate affairs. I would like to close with these thoughts. When I complete the pre-op visit with my patients, I look them in the eye and I say, no one cares more than you and me that this operation goes well. All across the nation, physicians, in deeds and actions, are expressing the same sentiment in how they care for their patients. Do not relinquish the single most important advocate you will ever have for the health care you need, your physician. In the current bill, the politicians have made it eminently clear that they will decide what is indicated, cost-effective, and fair for you and your doctor, and then ration care accordingly. We've seen this in Canada and in Great Britain. We must not let that happen here. Contact your elected officials and tell them no thank you to federalized health care and yes to private sector solutions. If we, the people, can craft the solutions to this complex problem, we will have done a mighty thing for our country and for our children.